Welcome to HealthWatch, presented by Novant Health. I'm June Baker, and I'll be your host today. This show is all about exploring health topics that matter to you and to your family. We appreciate the opportunity to introduce you to local physicians and health professionals who serve as our experts. Today, our guests include nurse practitioner Elizabeth Warren DeSandre with Novant Health Urology Partners. Then we'll meet Dr. Hiroshi Andrews with Novant Health Gastroenterology Brunswick. And finally, we'll meet Dr. Joshua Winslow with NHRMC Physician Group Cape Fear Heart Associates, who will talk about heart care in Brunswick County. So stay tuned to HealthWatch to learn more. Please welcome my guest, nurse practitioner Elizabeth DeSandre. Elizabeth, thank you so much for coming today. I know how busy you are, and I know you've recently started a new position, so I'm so happy that you're here to tell us about that. But before we do that, I want to introduce you to the community, so tell us a little bit about your background.
Okay, well, I've been with Novant now for 7 years. I started as a registered nurse in labor and delivery, and I've enjoyed that, and I'm happy that I've transitioned to a nurse practitioner role.
That's awesome. Tell me, where did you go to school? Are you a local girl?
I am a local girl, yes. I'm born and raised right here in Brunswick County. I grew up on Oak Island, yeah. So I started my nursing, I got my associates at Brunswick Community College.
Nice.
Yeah. And then I decided pretty quickly that I wanted to continue my education, so I got both my bachelor's and my master's at the University of North Carolina at Wilmington.
Oh, so you did grow up here, and where'd you go to high school?
I went to South Brunswick High School.
South Brunswick? Yeah. So tell me about your practice, your current practice, and then we'll talk a little bit about your providers, but
Sure.
Where are you working right now?
Right now our main office is in Bolivia, Novant Health Urology Partners. I've started in June, so fairly new. I work alongside Dr. Lydia Lebachetta and Dr. Stephen Robbins.
Yeah, they're great providers. We've had them on the show before, and I always enjoy having them. So I know that you see patients in Bolivia, but you have offices located elsewhere, correct?
We do, yes. We have several different satellite offices, so we also see patients in Southport, Carolina Shores, and Leland.
And are you primarily located at the office here in Bolivia, or do you have to go to the
We
others?
all switch up.
You all
There's
switch
different
up?
days, yeah. We move around so that everybody gets the opportunity to see whomever they want.
Well, I know that you recently opened a new office at Brunswick Forest.
That's correct, yeah.
I think it was at Waterford, was it at Waterford before, and it's recently moved down to Brunswick Forest. How's that working?
It's really good. I mean, it's fairly new. Like once I started, that
Right.
kind of happened all at once. But
Yeah, it was a quick.
yeah, no, it's really nice. The office is beautiful. It's large. I think that's going to be a great asset to the patients in the Leland area.
Yeah, and that's a huge community. Brunswick Forest is just growing by leaps and bounds, and so it's so convenient. It's right there.
Yeah, it is.
So I think that, and there's lots of great places to eat and shop. And so
Yes.
are there specific days that they're at Brunswick Forest?
Yes, right now we're there Monday all day 8 to 5, and then on Fridays we're there half a day 8 to 12. We are trying to increase some availability down there, so you should in the near future see us there on Tuesdays.
Oh, that would be great.
Yeah.
So that's every week, Monday and Friday, and then.
Yeah.
I'm curious. I know you were in labor delivery, and to me, that would be the perfect space to be. You know, the babies are so much fun.
It is.
So, what drew you to urology?
That's a good question. We have this running joke. I didn't choose the urology life chose me. My last semester in school, we got to choose a specialty rotation, and I kind of wanted to step out of my comfort zone and try something different. I met up with Dr. Lebachetta, and she decided, hey, come on board, I'll be your preceptor. And so she showed me the ropes as a student, and I just fell in love with it. You could feel her passion for her specialty.
Yeah, she does have.
Yeah, so it felt like a good fit.
Yeah, and she's so much fun.
Yeah, she is.
She's a hoot, and to work with her would be a privilege,
Yeah.
I think.
Yeah, both her and Dr. Robbins are great teachers.
Yeah, Dr. Robbins is so mild-mannered and just so, he never gets upset.
Never.
It's a great practice. I think it's great. Do you have a specific area or focus in urology that you really like to read about, or?
You know, I'm still learning so much myself, but I see a whole bunch of recurring urinary tract infections.
Yeah.
So I'm reading up on that. I'm treating a lot of patients with that.
That's so common.
Yeah, it's so common. I'm also seeing overactive bladder, urinary
yeah.
incontinence, both men and women, erectile dysfunction, enlarged prostate. So we see so much of everything, and it's fascinating how much urology has to offer.
That's true. It can cause a whole bunch of different problems.
Yeah.
Well, I know that this month, September, is Prostate Cancer Awareness Month. And I believe it's the second most common cause of cancer in men, second to skin cancer. So for those watching, can you talk about some of the signs or symptoms of prostate cancer?
Sure. Well, interestingly enough, there's not really any signs or symptoms. So that's one of those things where you really have to stay on top of your health care and get screening exams. And for this one, you would get some blood work. It's called PSA. And from there, we would adjust your treatment plan and follow forward if we needed to.
That's good information. I know that for urology in particular, sometimes patients are a little shy about seeing certain kinds of doctors, and I think urology is one of them. I imagine you spend a lot of time trying to make patients feel comfortable. Yeah. Do you ever find that because you're a female, that's an issue with a male patient, or vice versa?
Yeah, I do think, I mean, different patients have different preferences, and you have to respect that.
Yeah.
You know, the fortunate thing is that we have both a male and female provider,
right.
so they can have their pick. You know, my job, whether they're comfortable or not, is to give them the best care possible. I'm going to maintain professionalism.
Right.
I'm going to, you know, make them as comfortable as I can be, because coming to see us for their concerns is a private and intimate matter.
Very.
So to let them know that their information is going to be confidential and private, it's very important.
It is very important. I'm glad to hear you say that. Do you encourage patients to speak up about their concerns to you? I mean, if they're being hesitant, do you have?
Yeah, I mean, you can kind of read people and see, you know, if something else is bothering them, and I know how to kind of approach people like that and kind of ask certain questions that might gear us towards a different conversation.
That's good. I'm so glad that you found urology. You seem to be very, very interested in it, and I'm glad that you're able to work with Dr. Labachetta. I know that you and I met earlier this year at the vaccine clinic when we were working at Brunswick Community College, and I so enjoyed working with you, and you were very willing to come and spend time in the rain and the snow and the this and the that. It was not good. Tell me a little bit how that felt for you. Did you enjoy that?
I did. It was very empowering. You know, I told you I'm from this area,
right.
So to give back to the community and be able to see hope in people's faces, I mean, it's just a wonderful experience to have.
I don't know about you, but I saw a lot of my friends and just acquaintances in there. Was that true for you too?
Yeah, I saw a lot of people, and a lot of people I didn't know, which was fine too. There were so many people, the numbers and the amount. It was a very well-run machine. The amount of cars, wait 15 minutes and go. I mean, huge numbers.
Get that shot in the arm and get out of here. But they were also thankful.
They were.
They were so appreciative. And how about all the cookies and all the candy that was brought in?
I have to learn how to say no.
And it was so cold and so rainy some of those days.
Yeah, we could have used hand warmers instead of all those cookies.
Yeah, well, you're right about that.
Yeah.
But, well, we appreciated your time that you spent there with us. It was very helpful. There were days when we were trying to pull people out of the woodwork to work, and so it was amazing that we had the turnout that we did. But anyway, thank you so much for coming on today.
Yeah,
It's
thank
been
you
a
for
pleasure
having
to
me.
get to know you, this side of you,
Yeah.
outside of COVID vaccine.
Yeah.
And I hope you'll come back and visit us soon.
Absolutely.
All right. Thank you so much.
You're welcome.
Please welcome my guest, Dr. Hiroshi Andrews with Novant Health Gastroenterology, Brunswick. Thank you so much for joining us today. I'm so excited to have
Pleasure,
you on.
June. Thanks for inviting me.
Yeah, you're quite welcome. Well, first of all, I know you're a very experienced gastroenterologist, but you're new to Novant Health.
That's right.
So what I love to do is introduce my new physicians to the community on this show, and just tell us a little bit about yourself. So let's start with your background.
Thank you.
You're welcome.
So I'm from the Northeast. I grew up in Vermont, and like a lot of Northerners, we found our hopefully last home here in coastal North Carolina. I was educated at Harvard with a degree in economics, actually, so I worked on Wall Street for a couple of years, but then found my true calling was medicine. So I did my medical school education in Philadelphia, where I met my wife, and we now have 4 children. And then I joined the Army on an Army scholarship, spent 11 years as a uniformed physician, some time in Korea and Afghanistan and in Georgia. And when we lived in Georgia, we had a nanny to help take care of our 3 kids in diapers at the time. And she told us about this wonderful place called Wilmington, which we'd never heard of. And we moved here after I got out of the Army. So we never looked back, yeah.
So how long have you been in practice?
I've been a board-certified gastroenterologist now for 15 years. And so that was 4 years in the Army, 10 years in private practice in Wilmington, and a little over a year before coming to Novant.
So tell me a little bit about your practice, your partner, and where you're located.
So we're located here in Brunswick County, and we see our patients at the gastroenterology office in Supply, and we do procedures at the ambulatory surgery center there, as well as here at Brunswick Medical Center Hospital. Our practice is, we hope to be essentially a full-service digestive health or gastroenterology practice with care in liver disease as well. So specifically, folks who have chronic digestive problems, anything from irritable bowel to heartburn to friends and family members who suspect they have a gallbladder problem or celiac disease, that's wheat protein allergy. Something's just not right about their stomach. Someone who's always had a sensitive digestive tract. We hopefully can evaluate the individual and help them feel better and alleviate concerns they might have about their digestive complaints. Again, we also see patients with liver problems, anything from abnormal liver tests all the way to various serious chronic liver diseases. And then you mentioned our partner, Dr. Stuart Futch, is coming on board, and he's a very experienced gastroenterologist as well. We're excited to have him because he has a specialty in biliary disease and does a special procedure called ERCP for folks who might need that service here in Brunswick County. So essentially, we're hoping that your family doctors will be able to have confidence in referring you to us if needed, with the complete assurance that we can help diagnose and manage just about all of your digestive and liver concerns.
I think you also have 2 extenders. You have 2.
That's right. Our advanced practitioners, Shannon and Dottie, are outstanding. They are experienced, very caring, and they oftentimes will see the patient in the office before either I or Dr. Futch perform a endoscopic procedure, that is an upper endoscopy or a colonoscopy if that ends up being necessary.
Now, I know that both of you scope in the endoscopy center as well as here at the hospital. And I'm curious, how do you decide which facility is the best place for that to happen?
Good question. So primarily it's a decision based on an individual's medical history. So specifically if they're quite healthy and don't have any concerning medical problems, then they're an excellent candidate to have their procedure at the ambulatory surgery center, which generally I think patients find is a better experience because it's smaller and not as intimidating, and you can pretty much get in and out quicker and get your hot breakfast sooner after your procedure. Here at the hospital, of course, we can take care of folks who do have more complicated health problems or medical conditions. We could say it's a safer environment for folks who need that.
Mm-hmm. And of course, if they're already an inpatient and need that procedure, they would be done here at the
Absolutely.
hospital.
You're right. I didn't mention that, but Dr. Futch and I will be taking care of folks who have any sort of digestive problem while they're hospitalized here at Brunswick Medical Center.
I know you went through a lengthy list of things that you diagnose and treat, but I wonder if there's anything of real clinical interest to you.
So the things that interest me actually are probably of the least interest to most gastroenterologists, which is, I would joke, job security for me. So specifically something called irritable bowel syndrome, which is very common, and some folks may have suffered from it their entire adult life and really not realize they have it. So that's something that is of interest to me. It's something that I focused my research on when I was in training as a gastroenterology fellow in the Army. It's something that typically affects women more than men, and women who are in the prime of their lives. So these are women who are in their 20s, 30s, and 40s, who have children perhaps, early careers, perhaps a spouse, and when they're affected, as they say, if mama's not happy, no one's happy, right?
Yes.
So we like to try to help these people get confidence that we can diagnose them if they have irritable bowel, and then treat them to help them, their quality of life and their entire life spheres also feel better.
That's really good information. In previous years, I know that people without any risk factors have been encouraged to have their first colonoscopy at 50. But recently, I think that has changed. Is that correct?
You're exactly right, June. So just as of the last 6 months, the United States Preventive Services Task Force, which is the primary arbiter of when we should get screening tests done, made a decision that it is advisable to have their first colonoscopy, that is, just like you said, average risk individuals to have their first colonoscopy starting at age 45. Now, if you're 48 or even 52 and you haven't had your colonoscopy, there's no need for alarm, but certainly individuals now who don't have any family members who have had colon cancer and are in good health are now candidates to have their first screening colonoscopy beginning at age 45, just like you said. That's correct.
Yeah. That's really good information, because we've all been going by the old adage, if you're 50, you need a colonoscopy, and now we need to rethink that and maybe start having those conversations sooner.
That's correct. So that's another thing to talk about when you see your family doctor.
Yeah, which we encourage everyone to have a primary care physician.
Absolutely.
Yeah. Are you taking new patients?
Yes, ma'am.
Oh, good.
Absolutely.
That's awesome. How about referrals? Do we need a referral from our primary care? Or
Typically,
can we call the office?
Good question. So typically a referral is required depending on the patient's insurance. We do accept self-referrals as well, so it depends.
It depends.
But yeah, please, if you do have your primary care provider, reach out to them, make an appointment, and then that's typically the best way to get an appointment with one of us at the gastroenterology office.
And if our viewers need any information about the practice, I'm sure they can just call the main number at the gastroenterology practice, and we'll be able to help them out.
That's right.
Great.
Or they can go to our website, and our contact information should be there too.
Wonderful. Well, thank you so much for coming today. I hope you'll come back soon after you've been here a while, and we'll talk about what's going on.
Thanks, June. Always a pleasure, and I look forward to seeing you again.
Thank you so much. Please welcome my guest, Dr. Joshua Winslow, with NHRMC Physician Group, Cape Fear Heart Associates, and now part of Novant Health.
True.
Dr. Winslow, thank you so much for coming on the show today.
Thank you for having me.
It's great to have you. Now, we had you on right after you moved here, I think. You
Right.
were a guest on our show. It was not long after you moved to the area. So tell me what your area of focus is in cardiology in Brunswick County and Novant Health.
I'm a invasive cardiologist. I do all non-invasive and diagnostic cardiac casts. So I'm kind of a jack of all trades, and is a good fit for me here.
Yeah, well, we're really happy to have you. Tell me about what services that you offer at your clinic.
So our office is right next door, and we offer all stress testing, echocardiograms, sonograms of the heart, carotid Dopplers, and ultrasounds of the abdomen for looking for aneurysms. And then we see we interrogate defibrillators and pacemakers, everything that you need as an outpatient.
So if you have one of those devices, you can check that at the clinic. That's great. So tell me about the testing and services that are provided here at Novant Health Brunswick Medical Center.
All the same services, outpatient and inpatient, nuclear stress tests, echocardiograms. We do transesophageal echocardiograms, which are specialty echoes where we have you swallow a small tube under sedation and get closer to the heart, get better pictures. We do that here. They offer more, our fine vascular surgeons read the peripheral vascular studies, Dopplers, and some carotids here as well.
I know that at Novant Health Brunswick Medical Center, they offer diagnostic heart catheterizations. Can you talk to me more about that?
Yeah, when I came here, we restarted a cardiac catheterization program. That's an invasive look. We put catheters in an artery, get access to an artery, and do angiograms on the coronary arteries. We do diagnostics only here. We don't have interventional at this point. But we have that as a service to work up valvular heart disease, coronary artery disease, and we're doing that twice a month here.
Well, who's an ideal candidate for the diagnostic cath here?
Right. The ideal candidates are people that are pre-valvular heart disease workup, where we're not planning on doing an intervention because we don't do interventions here. People with sick hearts are called cardiomyopathies, where we're not sure what the cause is, and doing anything we're planning on doing just a diagnostic cardiac cath for at this point. So if you're having a heart attack, we don't do the diagnostic here. We're going to go where the interventionalists are that do stents and get it all done at once.
So you would only have one cardiac cath.
Right.
So that's really good information. I knew we did them here, but I wasn't sure who would be a great candidate for that. Today, I know you know it's September's National Atrial Fibrillation Awareness Month. And so I wanted to talk a little bit about AFib. So I know if you let it go and it's not controlled, it is a risk factor for strokes and what have you. But can you talk to me about the symptoms of AFib? What does that feel like?
Well, atrial fibrillation is when the small chambers at the top of the heart go into electrical storm. And two things happen. Your heart is going to run as fast as it can because it's being bombarded by the electrical impulses from above. So even at rest, your heart's going to go at running speed. So your heart rate goes fast. Second, with electrical storm, the atria don't contract. They just kind of sit there, and the blood flows through them like a passive conduit. But when blood doesn't flow in a very efficient manner, there's little areas in the left atrium, mainly the left atrial appendage, which is a windsock or a little appendage off the left atrium, that can fill up with clot when it's not moving so fast, because blood likes to clot. And then the little bits of clot can let go, and there's a risk for embolic stroke. So those are the two main things we look for. So if you have a lot of risk factors, we treat with blood thinners, full blood thinners, not just aspirin. You might hear some of these things on TV called Xarelto or Eliquis. And we give rate control medicines to slow down the heart initially, to rate control so you're not running fast all the time. And ultimately, there's a variety of treatments for atrial fibrillation, antiarrhythmics, and getting you out of it would be a cardioversion where we make you sleepy and shock the heart. All the way through antiarrhythmics to even electrophysiology studies and called ablations, where they try to cure you of the AFib with a catheter-based procedure. Symptoms would be shortness of breath, chest pain, palpitations, fatigue. Hopefully, your first presentation wouldn't be a stroke, but it is a major cause for stroke. And another symptom is no symptoms at all. People might not know they have AFib, And
You wouldn't feel that?
Many people don't. And so that's,
Well, that's scary.
yeah, sometimes we find it incidentally, or when they come in for a procedure, they go into it. So, yeah, it's a bit scary. I think with a lot of the technology nowadays, people with their Fitbit watches and whatnot,
Yeah,
are
that's
picking up
true.
more of that.
Yeah. Well, can you go in and out?
Yes, you can go in and out. And the risk for stroke is the same for going in and out as being in it all the time.
Wow, that's an interesting topic. I
And
wasn't
it's the
aware
most
of-
common arrhythmia known
Is
to
it?
man or woman. It's very common. I would say half my inpatient consults are AFib.
Really?
Yeah.
Well, I know someone, and he usually knows when he's out,
Right.
and he just calls the doctor, and they work on it together. And,
Right.
you know,
I think it's important if you're having these symptoms to see a cardiologist, at least your
Yeah.
primary care doctor, get checked out,
Right.
And then a referral from a cardiologist if they're finding atrial fibrillation.
that's good. I know I asked you this last time, but I think it bears repeating. I think most of our viewers, I know I am, interested in my heart health, and I think that most people are. Can you give me some general tips that we can go by just to support our heart health?
I would say getting regular
Go on a
aerobic,
diet, right?
regular aerobic exercise, 20 to 30 minutes at least 5 times a week.
Yeah.
And trying to emulate a plant-based diet the best you can. Dr. Dave Ornish has written books and has done studies that show there's reversing coronary artery disease with a plant-based diet. It's part of our cardiac rehab program for people with stents and coronary and bypass. Exercise, of course, diet we spoke about. And if you have risk factors such as smoking, diabetes, high blood pressure, family history,
I was
anything
gonna
that you
ask
can modify and generally live healthy is really what we need to do. If you have very high cholesterol and you have some plaque and some known coronary artery disease, we recommend getting your cholesterol very low with medicines, and that reduces the risk for recurrent heart attack.
How important is your family history? Does that play a huge part in?
If you have early coronary artery disease, that is a cardiac risk factor. That would be a primary family member,
Okay.
a mother that's a female getting coronary artery disease diagnosed before the age of 65, and for men before 55.
Wow.
So if you have that in your family history, that's a risk factor for you.
Yeah. Okay. Do we need a referral to see you, or can patients just call your office to make an appointment?
A little bit of both. It depends on your
Yeah,
insurance plan. So I don't really.
But your office staff could
Right. They can.
point them in the right direction.
And I think it's important to keep your primary
I think
care
so, too.
doctor in the loop. I think they're kind of the gatekeepers for
Yeah.
symptoms. They do the initial workup and they can help you decide if you need a cardiologist.
Yeah. Well, I think when you go to too many doctors and you don't have somebody in charge, like a
Right.
primary care, to look over all the medications you're taking to make sure there's no.
They're the captain of the ship, and it really, there's a lot of things they can do ahead of time to make your visit with a cardiologist more efficient.
Right. Lastly, are you taking new patients, and is Keep Your Heart taking new patients?
Yes, we are. We have new patient slots every day, and we do see new patients.
Okay,
We
that's
just
good.
hired several cardiologists also.
Yes, your
in our
group is
expanding
getting
group.
very
Yeah.
large.
Yeah. So
Yeah, and you see patients in multiple locations, so that's really good for
We
the
do.
patient.
Yeah.
So, well, thank you so much for coming back on the show. It's always a pleasure to have you. I always learn something new, and I look forward to seeing you soon.
June, thanks for having me.
You're quite welcome. Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. To find a doctor or learn more about services provided at Novant Health Brunswick Medical Center, please visit our website at novanthealth.org. Be sure to join us next time on HealthWatch.